The wind in Vermont carried secrets the way it carried snow, silent, relentless, burying everything. Lily Eleanor Voss was born in 1919, in a village whose name has been erased from most maps, tucked between hills that knew how to keep quiet. Her parents, German immigrants who fled the Great War with nothing but trauma sewn into their coat linings, built a life from silence and labor. They never spoke of what they left behind. Lily learned early that some truths were meant to stay buried. By 1947, she was 28 years old, an age when most women in her town were tending to second or third children, their hands worn smooth from domesticity. Lily's hands were different, calloused from needles and thread, stained with fabric dye that never quite washed out. She worked at the Crescent Mill, a textile factory where the looms screamed from dawn until dark, where lint hung in the air like ghosts of cotton fields far south. She was good at her work, better than good. Her stitches were tight, invisible, perfect. The floor supervisor once said she could sew a wound so clean it would never scar. Lily never forgot that compliment, or the way he looked at her when he said it. But it wasn't her skill with thread that made her dangerous. It was her skill with people. In the factory, between the deafening rhythm of machines, Lily became a node in an invisible network. The women spoke to her, shared grievances, whispered about injuries that went unreported, wages that disappeared, supervisors whose hands wandered where they shouldn't. Lily listened, remembered, connected the patterns. And then she met Thomas Abernathy. He was a union organizer, married, 20 years older. A man whose words could ignite crowds the way matches ignite gasoline. He came to Crescent Mill in the winter of 1946, speaking of worker rights and collective bargaining and dignity. The mill owners watched him like predators watching prey. Lily watched him differently. What grew between them was not love in any recognizable form. It was recognition. Two people who saw the same rot beneath the surface of things. They met in secret, in storage rooms, in the forest beyond the factory, in moments stolen from the machinery of their separate lives. She knew he would never leave his wife. He knew she would never ask him to. The pregnancy was an accident, or perhaps inevitability. By March 1947, Lily's body carried evidence of their transgression, swelling beneath the loose dresses she sewed for herself. But the child was not what sealed her fate. It was what she saw on the night of April 12, 1947. Lily had stayed late at the factory, finishing a rush order. The building was mostly empty, the looms silent for once. She was cutting through the administrative corridor when she heard voices behind a closed door. Male voices, familiar. She stopped, listened. Through the crack beneath the door, she could see shadows of feet. Could hear words like accident report and compensation waived and the state inspector has been accommodated. Numbers were discussed, large numbers, the kind that made men's voices drop to whispers. She recognized one voice immediately, Mr. Horace Whitfield, the mill owner. The other belonged to someone she'd never heard before, someone whose authority saturated every syllable. They were discussing the explosion that had killed 2 workers the previous month. The explosion that was ruled mechanical failure. The families that received nothing. Lily's hand moved to her swollen belly without thinking. Protection. Instinct. She left the corridor silently, the way she'd learned to move through the world. Unnoticed, invisible. But someone had seen her. A security guard she'd never spoken to. A man whose name she didn't know, but whose face she would remember in the darkness of what came after. He reported her presence to management. Management reported her to Mr. Whitfield, and Mr. Whitfield, a man who understood the machinery of power better than he understood the machinery of textiles, made a single phone call. 3 days later, 2 men in suits arrived at Lily's boarding house. They carried papers, official documents with official seals. They spoke in the measured tones of bureaucracy, the language of systems that devour inconvenient people. The diagnosis was already written. Hysteria, chronic, with delusional tendencies. Lily read the words upside down as they placed the form on the table before her landlady. She understood immediately. This was not medicine. This was erasure. "Miss Voss," one of the men said, his voice flat as a closed door. "You've been remanded to the care of Ravenswood Psychiatric Institute for observation and treatment. Effective immediately." The room tilted. Not from madness, from recognition. She was being disappeared. There was a particular violence in how easily a woman could be erased in 1947. No trial, no witnesses, no defense, just signatures on forms, stamps on paper, and the quiet efficiency of men who believed they were protecting society from itself. The documents that condemned Lily Eleanor Voss were remarkable in their banality. Declassified records from the Vermont State Medical Board, released only in 1982 after sustained pressure from mental health reform activists, reveal a diagnostic report dated April 16, 1947. The examining physician, Dr. Edmund Casterbridge, a general practitioner with no psychiatric training, spent exactly 11 minutes with Lily before rendering his assessment. His notes, preserved in their original form, read, "Patient presence with agitated affect and paranoid delusions regarding persecution by factory management. Claims to have witnessed criminal conspiracy, demonstrating clear departure from reality. Patient is unwed and pregnant, suggesting moral deficiency and compromised judgment. Family history of immigrant background raises concerns about hereditary degeneracy. Recommend immediate institutional commitment for protection of patient and community." 11 minutes, 66 words. 28 years of life reduced to a paragraph. The diagnosis was signed by 2 additional physicians who never examined her. Their signatures, neat, practiced, identical to thousands of others on similar forms, were enough. The law required no more. Hysteria was a convenient word. It had been for centuries, a diagnosis that could mean everything and nothing. Too emotional, too sexual, too quiet, too loud, too anything that made men uncomfortable. Lily understood this as she sat in the locked room of the boarding house, waiting. Her landlady, Mrs. Gertrude Phelps, a woman who attended church 3 times weekly and spoke often of Christian charity, had locked the door from the outside. For Lily's own safety, she'd said, to prevent her from harming herself. Through the thin walls, Lily could hear Mrs. Phelps speaking with the men from the state. "I noticed the signs weeks ago," Mrs. Phelps was saying, her voice carrying that particular tone of concerned citizenship, talking to herself, paranoid about being followed, and the moral situation? Well, that speaks for itself, doesn't it? Lily had never spoken to herself, had never mentioned being followed. But the truth was negotiable when a woman's reputation preceded her judgment. Unwed, pregnant, working class, immigrant parents, witness to corruption. Each fact alone might have been survivable. Together, they formed a perfect trap. The room was small, a bed, a washstand, a single window that looked out onto the gray April afternoon. Lily sat on the bed, her hands folded over her belly, and waited with the patience of someone who had finally understood the machinery closing around her. She thought about Thomas. Whether he knew, whether he cared, whether his wife had finally discovered what he'd done in the dark spaces between his union meetings. She thought about the 2 workers who died in the explosion, their names, Michael Bronsky and James Chen, their families, still waiting for compensation that would never come. She thought about the voice behind the door, the man whose authority had saturated every word, the man whose name she still didn't know but whose crime she could testify to. And she understood, with the clarity of the condemned, that this was why the diagnosis had come so swiftly. Not because she was pregnant, not because she was inconvenient, because she was dangerous. The men returned at dusk. They brought restraints, leather straps, buckles that clicked with bureaucratic finality. They were polite, professional. They explained the procedure as though she were a child being prepared for a necessary medical intervention. "It's for your safety during transport," one of them said. "Standard protocol." Lily did not resist. Resistance would have been noted in the report, evidence of her volatility, her aggression, her madness. She let them bind her wrists. Let them guide her down the stairs of the boarding house while Mrs. Phelps watched from the kitchen doorway, her face arranged in an expression of sorrowful concern that would look appropriate to any neighbors who might be watching. The vehicle was unmarked, black, official in its anonymity. It smelled of disinfectant and fear, the residue of others who had made this journey before her. As they drove north, away from the village, away from the factory, away from everything she'd known, Lily watched the landscape through the window. The hills of Vermont gave way to flatlands, then to the dense forests of New York State. The road followed the Hudson River, and as the water came into view, gray and cold and indifferent, she saw it. Ravenswood Psychiatric Institute. It rose from the landscape like something that had grown there rather than been built. Blackened brick, Gothic spires, windows that reflected nothing but sky. A fortress designed not to keep danger out, but to keep it in. The gates opened silently. The vehicle passed through. Behind her, the gates closed with a sound like a page turning, or a book slamming shut. No one had asked her a single question. No one had listened to a word she said. Her mouth still held all 32 teeth, for now, but Lily could already feel them becoming obsolete. Words were not currency here. Silence was the only language Ravenswood understood. The Institute smelled of erasure. Not death, not decay. Something more insidious. The scent of lives being methodically scrubbed away. Ether mixed with lye soap. Disinfectant so strong it burned the throat. And beneath it all, something organic and desperate. Sweat, urine, the particular musk of fear that had soaked into the walls over decades. Lily Eleanor Voss entered Ravenswood Psychiatric Institute on April 17, 1947, at 4:47 in the afternoon. The precision of the time was noted in the intake log, along with her height, weight, and a physical description that reduced her to measurements. Female, white, 5'4", 118 lbs, brown hair, brown eyes, no distinguishing marks. No mention of the pregnancy. That detail had been omitted from the transfer papers deliberately. The intake room was located in what had once been the grand foyer of a Victorian mansion. Before the Institute, before the conversion, this building had belonged to a railroad magnate named Cornelius Raven, hence the name that now hung over its purpose like a curse. The original chandelier still remained, though half its crystals were missing or dulled by decades of institutional neglect. It cast fractured light across marble floors worn smooth by the shuffle of thousands of feet. A nurse processed her, not unkindly, not with cruelty, with the efficient indifference of someone cataloging inventory. Remove your clothing, place personal items in the bin. Lily complied. Her dress, the one she'd sewn herself from fabric scraps stolen from the mill floor. Her undergarments, mended and remended. A small silver locket containing a photograph of her parents taken before the war had hollowed them out. The locket, Lily said quietly. May I? No personal items. Policy. The word hung in the air like a door closing. Policy, the great equalizer, the excuse that required no justification. She was given a uniform. Gray cotton, shapeless, identical to the ones worn by every other woman in the building. A number was stitched into the collar, 2847. Your name? The nurse asked, pen poised over the intake form. Lily Eleanor Voss. The nurse wrote, Patient, 2847. Follow me. The corridor stretched impossibly long. Walls painted institutional green, that particular shade found only in government buildings, schools, and places where hope went to die. The floors were concrete, cold even through the thin slippers they'd given her. Pipes ran along the ceiling, dripping condensation that left rust stains like old blood. Doors lined both sides. Solid wood with small observation windows reinforced with wire mesh. From behind them came sounds, crying, muttering. Laughter that contained no joy. And silence. So much silence. They passed other patients. Women in identical gray uniforms, some shuffling alone, others in small groups supervised by attendants. Their faces held a particular emptiness that Lily would come to recognize as the Ravenswood expression. The look of people who had stopped expecting rescue. One woman met Lily's eyes as they passed. Her face was young, but her eyes were ancient. She mouthed 2 words: "Get out." Before Lily could respond, an attendant, a heavy-set man with keys jangling from his belt, grabbed the woman's arm and steered her away. "No communication between patients during processing," the nurse said, not looking back. "Policy." They descended, stairs leading down into the building's basement levels, where the original mansion's wine cellars and servant quarters had been converted into something else entirely. The temperature dropped with each step. The smell intensified. Lily's cell was at the end of a long corridor. Cell, not room. That's what the architecture communicated. 4 walls, a narrow bed with a thin mattress, a metal toilet without a seat, a single bulb in a wire cage overhead, controlled from outside. "Evaluation tomorrow morning," the nurse said. "Doctor will see you at 8. "Which doctor?" "Dr. Thorpe. He evaluates all new admissions." The name meant nothing to Lily then. It would mean everything soon. The door closed. The lock engaged. The footsteps receded. Lily stood in the center of the cell and took inventory of her new reality. The walls were brick, painted white at some point in the distant past, now yellowed and water-stained. Someone had scratched marks into the paint near the bed. Not words, just lines counting something. Days, perhaps. Or years. She sat on the bed. The springs groaned. The mattress smelled of previous occupants, their sweat, their tears, their slow dissolution. Through the wall she could hear breathing. Another woman in the adjacent cell. The breath came in ragged gasps, punctuated by whispered words Lily couldn't quite make out. Night fell. The bulb overhead dimmed but never went dark completely. Institutional lighting, enough to see by, never enough to sleep easily. Lily lay on her side, hands folded over her belly, and felt the child move. A flutter, a reminder that she was not singular, that whatever happened next would happen to both of them. At 11:17 p.m., she counted the chimes from a distant clock tower. Footsteps approached her door. Multiple sets, male voices, low and casual, discussing something mundane. A baseball game, weekend plans. They stopped at her door. The observation window darkened as someone peered through. "New one?" a voice said. "Thorpe's patient?" "Yeah, starts tomorrow." "Dental?" "Full protocol." A pause, then laughter. Brief, knowing. The footsteps moved on. Lily sat up, heart hammering against her ribs with a rhythm that felt like warning. Dental protocol. She ran her tongue across her teeth. All 32 still intact. Still hers. Something in the casual cruelty of that laughter told her they wouldn't remain that way for long. In the darkness of cell 2847, Lily Eleanor Voss understood that her real evaluation had already been completed. She had been judged, sentenced, catalogued. Now came the execution. They came for her at dawn. No warning, no preparation. Just the metallic scrape of the lock and 2 orderlies entering cell 2847 with the methodical efficiency of men who had performed this task countless times before. "Patient 2847, come with us." Lily had not slept. The thin light of morning filtered through a window she couldn't see, somewhere high above the basement level, turning the institutional green walls the color of algae. "Where?" she asked. No answer. Answers were not part of the protocol. They led her through corridors she hadn't seen the previous day, deeper into the building's interior, away from anything resembling the outside world. The sounds changed here. No crying, no muttering. Just the hum of machinery and the antiseptic silence of medical spaces. The dental clinic occupied what had once been the mansion's conservatory. The original glass ceiling remained, though decades of grime had rendered it opaque. Weak daylight struggled through, creating a greenish underwater quality to the air. 3 chairs dominated the room. Not dental chairs in any modern sense. Converted barber chairs, equipped with leather restraints at the wrists, ankles, and across the forehead. Restraints worn smooth by use. Dr. Harlan Thorpe stood beside the center chair, reviewing a file. He was younger than Lily expected, perhaps 40. with the kind of face that belonged in university lecture halls, not in basement medical facilities. Wire-rimmed glasses, neatly trimmed beard, hands that moved with surgical precision as he turned pages. He looked up as the orderlies brought her in. His eyes were gray, analytical. They catalogued her the way one might catalog a specimen. "Patient 2847, he said. Not a question, a confirmation. "My name is Lily Voss." He wrote something in the file. "Persistent identity fixation, noted." The orderlies guided her to the chair. Their hands were not rough, but they were immovable. Lily sat because resistance would be recorded as violence. Violence would justify sedation. Sedation would mean losing awareness of whatever came next. The restraints clicked into place. Wrists, ankles, forehead. She could move her eyes, nothing else. Dr. Thorpe approached, rolling a metal tray beside the chair. Instruments glinted in the weak light. Tools that resembled dentistry only in the loosest sense. Pliers, extractors, clamps designed for larger animals. "Open your mouth," he said. Lily kept it closed. He nodded to one of the orderlies, who produced a metal device, a mouth prop, spring-loaded, designed to force the jaw open and hold it there. The orderly's fingers pried at her lips. Lily resisted until her muscles trembled. But biology has limits. The prop slid between her teeth and expanded with a mechanical click. Her mouth was no longer her own. Dr. Thorpe leaned in, examining her teeth with a small mirror. His breath smelled of coffee and peppermint. The incongruous normalcy of it was somehow worse than if he'd smelled of chemicals or death. "Remarkable," he murmured. "Perfect alignment, no decay, excellent bone density." He straightened, making notes. "The health of the teeth is often inversely proportional to the health of the mind," he said, speaking to her but not to her, the tone professors use when lecturing to an auditorium. Focal infection theory posits that toxins from infected teeth migrate to the brain, causing insanity, moral degeneracy, criminal behavior. Removal of the infectious source therefore removes the pathology. Lily tried to speak. The prop reduced her words to vowel sounds, primitive and helpless. "Your file indicates paranoid delusions, sexual deviance, and aggressive tendencies toward authority," Thorpe continued. "Classic manifestation of dental toxemia. We'll begin with the molars. They're typically the primary vectors." He selected an extractor. "No anesthetic, no numbing agent. This may cause discomfort," he said. The clinical understatement of a man describing inevitable agony. But pain is often instructive. It teaches the body what the mind refuses to accept. The first tooth was lower left, second molar. He positioned the instrument, found purchase on bone, and pulled. There are inadequate words for this kind of pain. It transcended the physical, becoming something metaphysical. A violence so complete it shattered the boundary between body and self. Lily heard screaming and understood distantly that it came from her own throat, though the sound seemed separate, belonging to someone else. The tooth resisted. Dr. Thorpe adjusted his grip, braced his foot against the chair base, and pulled harder. Something cracked, not cleanly. The molar fractured, part of the root remaining embedded in bone. Thorpe said. Stubborn. He reached for a different tool, sharper, designed for excavation. Time dissolved. Minutes became hours, became eternities measured in the scrape of metal on bone, the wet sound of tissue tearing, the copper taste of blood filling her mouth faster than she could swallow. 3 teeth in the first session, lower left molars and 1 premolar, each extraction more brutal than the last as Thorpe worked to remove roots that had anchored themselves deep. When he finally stepped back, Lily's vision swam. Shock, blood loss, pain beyond the body's ability to process. Her mouth was a cavern of raw nerve endings, each breath across exposed bone a fresh agony. Excellent progress, Thorpe said, removing his blood-speckled gloves. We'll continue the protocol every 3 days. 18 sessions total should achieve complete dental ablation. He made a note in her file, then looked at her directly for the first time since beginning. You may experience some discomfort over the next few days. This is normal and indicates the treatment is working. The infection is being purged. They removed the restraints. Lily couldn't stand. The orderlies half-carried, half-dragged her back to cell 2847. They deposited her on the bed and left without a word. She lay on her side, mouth filling with blood, and understood with absolute clarity. This was not medicine. This was punishment. Silencing. Erasure of the capacity to speak. 3 teeth gone. 29 remained. 18 sessions. The mathematics of her dismantling had been precisely calculated. Through the wall, she heard breathing again. The woman in the adjacent cell, closer now as though pressed against the brick. A whisper, barely audible. "Don't let them take your name." Lily wanted to respond, but her mouth was a wound, words impossible. So she tapped the wall. 3 times. Acknowledgement, solidarity. The breathing steadied. Then, 3 taps in return. In the silence of Ravenswood, where words were being systematically extracted, the women learned to speak in other languages. Morse code of survival, rhythm of resistance. The Institute could take their teeth, but it had not yet learned how to take their witnessing. Recovery was not permitted at Ravenswood. 72 hours after the first extraction, Lily was returned to the dental clinic. Her mouth had not healed. The wounds were still open, gums swollen and infected, bone exposed to air. But the protocol had been established. Every 3 days. 18 sessions total. The calendar became a countdown to obliteration. Between sessions, she learned the rhythm of the Institute, how the building breathed. Pipes clanking at 4 a.m. when the boilers ignited. Footsteps overhead at shift changes. The medication cart rattling down corridors at precise intervals. She learned which guards could be met with eye contact and which would punish such defiance. She learned that speaking was discouraged, but silence was mandatory. The woman in the adjacent cell was named Ruth, or had been named Ruth. She no longer responded to it. They communicated through the wall, taps, rhythms, a language invented from necessity. Ruth had been at Ravenswood for 6 years, admitted for nymphomania, a diagnosis applied when her husband discovered her reading contraceptive literature. She had been 23 then. The Institute had aged her into something ancient. On the 5th night, during the hours when the skeleton staff dozed at their stations, Ruth tapped out a warning. "Basement, don't go." But Lily had already been planning to go. The dental sessions followed a pattern. Orderlies collected her from cell 2847, escorted her through specific corridors, returned her the same way. But during the 4th session, teeth 6 through 8, upper right quadrant, she'd noticed something. A door left ajar in the sub-basement corridor. Beyond it, stairs descending further into the building's foundation. Stairs that went down, below the basement, below the cells, below the official architecture of the Institute. On the 11th night, Lily made her attempt. The cell locks were simple, designed to keep the drugged and defeated inside, not to withstand a woman with factory-trained fingers and a hairpin stolen from a distracted nurse. The lock yielded with a click that sounded catastrophic in the silence. She waited, counted to 100. No alarm, no footsteps. The corridor stretched empty in both directions, lit by bulbs spaced too far apart, creating pools of shadow between islands of sickly light. Lily moved through the darkness, barefoot, the concrete floor so cold it burned. The sub-basement door was still unlocked. An oversight, or perhaps intentional. Who would willingly descend into deeper darkness? The stairs were stone, worn smooth in the center by centuries of feet. They spiraled down into blackness. No lights, no railings, just descent. Lily followed the wall with her fingertips, each step an act of faith. The temperature dropped. The smell changed. Less disinfectant, more earth and water, and something chemical she couldn't identify. At the bottom, a corridor, narrower than those above. The ceiling so low she had to duck. Doors on both sides, but these were different, heavier, reinforced. With observation windows covered from the inside, she tried the first door, locked. The second, locked. The third door opened. The room beyond was an archive. Filing cabinets lined the walls, floor to ceiling. Metal cases containing documents that should not have been in a psychiatric institute. Medical records, yes, but also legal documents, financial ledgers, correspondence on official letterhead from pharmaceutical companies, from government agencies, from universities. Lily pulled a file at random. Patient 1847, female, age 19, admitted 1943, diagnosis, moral deficiency due to illegitimate pregnancy. Treatment log, sterilization procedure completed 06-12-43 without complication. Patient unaware of intervention performed under guise of appendectomy. Another file, patient 2103, female age 34, admitted 1945. Chronic hysteria. Treatment log, insulin shock therapy 40 sessions. Transorbital lobotomy 3/17/46. Patient now docile and compliant. Suitable for domestic labor placement. Another. Hundreds of files. Thousands. The patterns emerged like a photograph developing in chemical bath. Women admitted for convenience, not illness. Procedures performed without consent. Sterilizations disguised as routine surgeries. Lobotomies performed on the incorrigible. Experimental drug trials using patients as unwitting subjects. And buried in the financial ledgers, payments. Large payments from corporations whose names Lily recognized from newspaper advertisements. Pharmaceutical companies purchasing research subjects. Chemical manufacturers testing compounds. Government agencies funding studies on hereditary degeneracy. Ravenswood wasn't a hospital. It was a laboratory, a human abattoir operating under the legitimacy of medicine. Lily was photographing pages with her mind, memorizing names and dates and procedures, when she heard it. A sound, wet, rhythmic, coming from deeper in the basement. She followed it to another room. The door was marked with a painted red cross, the symbol for medical waste. Inside, an operating theater. Primitive, Victorian. A table stained with substances that had soaked into wood grain. Instruments arranged on trays, and along the wall, glass jars containing specimens preserved in formaldehyde. Lily stepped closer. The jars held tissue samples, organs. And in the largest jar at the end of the row, a fetus, fully formed, perhaps 6 months gestation. The label read, Patient 2847, specimen collected 04-25-47. Her hand moved to her belly, still swollen, still carrying, but the dates, April 25th, 8 days ago. She had been unconscious after the second extraction, heavily sedated. She remembered pain that didn't match the dental work, cramping, bleeding. They had taken the child without telling her, without consent, while she was restrained and helpless, harvested it like a specimen. The room tilted, not from weakness, from rage so pure it burned through shock. Footsteps. Coming down the stairs, multiple sets, rapid. Lily ran. Back through the archive room, into the corridor, up the spiraling stairs. Her bare feet slapped against stone. Behind her, voices shouting, keys jangling. The machinery of the Institute awakening. She reached the sub-basement level, burst through the door into the familiar corridor, and collided directly with Nurse Patterson, the night shift supervisor. Their eyes met. Patterson's face showed no surprise, only resignation. Cell 2847, Patterson said to the orderlies who appeared behind her. Isolation. Dr. Thorpe to be notified immediately. They dragged Lily back, not to her cell, to a different room, smaller. Padded walls, no windows, no light, except what filtered under the door. The isolation cell. As they locked her inside, Lily pressed her face against the gap beneath the door and whispered to anyone who might hear. They're killing us. They're experimenting on us. Someone has to... The door to the corridor slammed shut. Her words died in darkness. But Ruth, pressed against the wall 3 cells away, heard the commotion, understood what silence meant, and began tapping, a new rhythm, a warning to be passed along the walls, cell to cell, woman to woman. They know she knows. Isolation lasted 7 days, or 7 years. Time became theological in the darkness, unmeasurable, eternal, punishing in its refusal to pass. They brought her out on May 2nd, 1947, for the 9th dental session. the midpoint of her dismantling. Lily had lost weight she couldn't afford to lose. The pregnancy was gone, her belly hollow. The absence of phantom presence more real than what had been. She moved like something mechanical, limbs operating on muscle memory while her mind resided elsewhere. Somewhere deeper. Somewhere the Institute couldn't reach yet. Dr. Thorpe noted the change in her file. Patient shows significant improvement. Affect flat, compliance increased. Treatment efficacy confirmed. He meant we broke something essential. Good. The 9th session took teeth 14 through 16. Upper left quadrant, the canines and adjacent premolar. These extractions were worse than the previous ones, not because the technique had changed, but because Lily's body had begun to understand what was happening. The jaw anticipated trauma, muscles clenching involuntarily, bones seeming to grip the teeth tighter as though they too were trying to resist. Thorpe worked methodically. He had developed a rhythm over 8 sessions. Grip, twist, pull. The sound of roots separating from bone had a particular wet cracking that echoed in Lily's skull long after the tooth was gone. 16 teeth now missing. Half her mouth a cratered landscape of healing wounds and exposed nerve. When she tried to speak, air whistled through the gaps. Words became slurred, primitive, difficult to form. Her tongue kept searching for teeth that weren't there anymore, finding only absence. They returned her to cell 2847. Not isolation. A gift, they implied. Proof of mercy. Ruth was waiting, 3 taps through the wall. Still here, still alive. Lily tapped back, weaker than before, but present. During the long nights between sessions, while pain made sleep impossible, Lily worked on memorization, the names and dates from the basement files. She had always possessed an excellent memory. Her factory supervisors had marveled at how she could recall complex pattern sequences after seeing them once. Now that skill became survival. She organized the information like ledgers in her mind. Patient, 1623, Mary Kowalski. Age 22, sterilized 1942. Reason given, hereditary feeble-mindedness. Real reason, Polish immigrant, 3 children, husband dead in factory accident, no family to question her disappearance. Patient 1891, Sarah Chen, age 28, lobotomized 1944. Reason given, chronic agitation. Real reason, witnessed health code violations at restaurant where she worked, threatened to report to authorities. Patient 2156, Ruth Margaret Hoffman, age 23, admitted 1941. Hysterectomy performed 1942 without consent. Still institutionalized. 2846. The woman on the other side of the wall. Lily hadn't known about the hysterectomy. Ruth had never tapped it out. The patterns were undeniable. Ravenswood systematically targeted women who were inconvenient. Witnesses to crimes. Whistleblowers. Those whose sexuality or reproduction threatened patriarchal control. Immigrants, poor women. Those without families who might ask questions, and the procedures served dual purposes, punishment disguised as treatment, and profit. The pharmaceutical companies paid per subject enrolled in trials. The government agencies paid for eugenic sterilizations. The families paid monthly fees for care. Everyone profited except the women being consumed. On the 14th night, Lily was lying awake, tongue exploring the vast emptiness of her mouth, when she heard a sound that didn't belong to the Institute's normal rhythm. Crying. Not the usual suppressed sobbing that filtered through walls. This was different. Raw, desperate, coming from above. She pressed her ear to the ventilation grate near the ceiling of her cell. The sound was clearer there. A young voice, a girl, perhaps 15 or 16. "Please, I didn't do anything. Please, I'm not crazy. I'm not..." A sharper voice, male. Authority soaked through every word. "You'll learn compliance, or you'll learn what happens to those who don't." A scuffle, a scream cut short. Then silence more terrible than sound. New admission. Fresh victim, the machine feeding itself. Lily closed her eyes and added the girl's voice to her mental archive. Evidence, testimony, witness. The next morning, an orderly came to her cell with an unexpected delivery, an envelope. Not mail. Inmates received no mail. This was internal correspondence. The orderly watched as Lily opened it with shaking hands. Inside, a single sheet of paper, typed. Official letterhead from the Ravenswood Medical Director's Office. Patient 2847. You are hereby informed that your cooperation with institutional procedures has been noted. Upon completion of treatment protocol, 9 sessions remaining, you will be evaluated for potential discharge to supervised community placement. Continued compliance is essential. Any further unauthorized movement or agitation will result in permanent commitment and enhanced corrective measures. Dr. H. Thorpe, Medical Director. A bribe, disguised as hope. Complete the extractions quietly. Let them finish erasing her capacity to speak. And maybe they would release her. Damaged, silenced, controllable. Lily read the letter 3 times. Then, very carefully, very deliberately, she tore it into pieces. The orderly's eyes widened. You shouldn't... Lily met his gaze. Her mouth was a ruin, half her teeth gone, her words slurred and whistling, but she spoke anyway. Tell Thorpe. I remember everything. The orderly stepped back. He'd seen compliance. He'd seen resistance. This was something different. This was documentation. Testimony being preserved in flesh and memory. He left without responding. The door locked. The cell returned to its familiar dimensions. Through the wall, Ruth tapped. What happened? Lily tapped back slowly, using their improvised code. They offered freedom. I chose truth. A long pause. Then, for the first time in 6 years of imprisonment, Ruth tapped something that sounded like laughter, or crying, or both. That night, a new rhythm started moving through the walls, from Ruth to the cell beyond, from that cell to the next, spreading through the basement level like water finding cracks in concrete. Not words, not even messages, just rhythm, acknowledgement, solidarity. The Institute had taken their teeth, their reproductive capacity, their legal rights, their families, their names. But in the darkness of Ravenswood, the women were beginning to remember they were not singular. They were collective. They were witness to each other's suffering. And witnesses, even silenced ones, even toothless ones, were dangerous. Somewhere above, in his office, Dr. Harlan Thorpe made a note in Lily's file. Patient showing signs of renewed resistance. Recommend acceleration of treatment protocol. Consider transorbital procedure if dental ablation proves insufficient for achieving compliance. 9 sessions remained, but Thorpe was already planning 10, 11, 12, whatever it took to erase her completely. He did not yet understand that erasure and documentation were not opposites. They were collaborators. The more he tried to destroy her, the more completely she became evidence. Patient 2847 was becoming a case file, a testament, a ghost that would outlive them all. The sessions continued with mechanical precision. Every 3 days, teeth extracted in pairs or triplets depending on their accessibility. By late May 1947, Lily had only 11 teeth remaining, scattered survivors in a landscape of absence. But something had shifted in the Institute's rhythm. Lily felt it the way animals feel earthquakes before they strike. An electricity in the air, guards whispering in corridors, files being moved in the middle of the night. Dr. Thorpe canceling scheduled sessions without explanation. On May 23rd, during what should have been the 13th extraction, Lily was left waiting in the dental clinic for 3 hours, strapped to the chair, alone, the restraints cutting into her wrists. When Thorpe finally arrived, his usual clinical composure had fractured. His hands trembled as he reviewed her file. His glasses sat crooked on his nose. He smelled of whiskey inadequately masked by peppermint. "They're coming," he muttered. Not to Lily, to himself. State inspectors, someone filed a complaint, some goddamn activist organization. He looked at Lily then, really looked at her. And she saw something flicker in his gray eyes. Not remorse. Fear. "You," he said. "Did you somehow—" "I can't write letters," Lily said. Her voice slurred through the gaps in her teeth. No pencil, no paper, no access to mail. But someone had. Ruth, perhaps. Or another patient with less supervision, or... And this thought crystallized as she watched Thorpe's fear bloom. One of the staff. A nurse whose conscience had finally exceeded her paycheck. Thorpe leaned close. His breath was sour. If you say anything, if you testify, they'll declare you incompetent. They'll say you're delusional. Who do you think they'll believe? A respected psychiatrist or a hysterical woman with half her teeth missing? Lily smiled. It was a terrible expression. All gaps and ruins. I don't need to testify. The files will. His hand moved faster than thought. A slap that snapped her head sideways. Blood from her gums splattered across the chair. There are no files, he hissed. Everything is destroyed. Everything. But he was lying. She could see it in the sweat beading his forehead. The files were too valuable, too dangerous to destroy completely. They were evidence, but they were also research data worth thousands of dollars to the pharmaceutical companies, the eugenics boards, the government agencies that funded this place. The inspectors arrived 3 days later. 2 men in suits, carrying briefcases and authority. The institute transformed overnight. Patients were scrubbed and dressed in clean uniforms. Violent cases were sedated into docility. The staff smiled and spoke in measured tones about therapeutic innovation and humanitarian care. Lily watched from her cell as they toured the upper floors, heard their footsteps overhead, their voices muffled but present. They would not come to the basement. They never did. Basements were for storage, for utilities, for things that didn't need inspecting. But that night, Nurse Patterson came to cell 2847. She was the senior night nurse, 43 years old, employed at Ravenswood for 18 years. Lily had cataloged her early on. Complicit, efficient, unremarkable. A woman who followed orders and collected her paycheck and asked no questions. Patterson stood in the doorway, backlit by the corridor's weak light. In her hands, a ring of keys. Master keys. Access to everything. I have children, Patterson said. Her voice was flat, factual. 2 daughters, 15 and 17. Every day I work here, I think, what if? What if someone decided they were inconvenient? What if someone diagnosed them? She stepped into the cell, set the keys on the floor, stepped back. The files are in the sub-basement, the real files, the ones they'll burn tomorrow before the inspectors return. Room 7, hidden behind a false wall in the back of the archive. You have 2 hours before the shift change. Lily stared at the keys. Why? Because someone has to remember. Patterson's face was stone. And it can't be me. I'm a coward. I have a pension to protect, a mortgage. But you've already lost everything they can take. She left. The door remained unlocked. A choice offered. A burden passed. Lily picked up the keys. They were cold, heavy. The weight of responsibility forged in metal. She moved through the sleeping institute like a ghost, down the familiar stairs to the sub-basement, past the archive room she'd discovered before, to room 7, unmarked, unremarkable, a door that looked like it led to a utility closet. The false wall was amateur work, plywood painted to match stone. It swung open on hinges when she pushed. Behind it, cabinets, filing cabinets that went from floor to ceiling, thousands of files, decades of documentation. She pulled them methodically, photographing with her mind, memorizing names, dates, procedures. Project Hygiene, federal funding approved 1935. Objective, sterilization of genetically inferior populations. Subjects, 2,847 procedures completed 1935-1947. Success rate, 100%. Complications, 47 deaths, recorded as surgical accidents. Pharmaceutical Trial 7B, Abbott Laboratories contract. Testing of experimental sedatives on involuntary subjects. Results, 12 fatalities, 34 permanent neurological damage, 156 successful suppressions of aggressive female behavior. Transorbital lobotomy program, 284 procedures, funded by State Eugenics Board. Criteria for selection, Incorrigible women showing resistance to institutional authority. Post-operative mortality, 23%. Post-operative docility, 100% of survivors. And then, buried deeper, she found it. The ledger she'd been searching for without knowing. A list of names. Women who had witnessed crimes, corporate fraud, domestic violence, labor violations, police brutality. Women who had been inconvenient. Each name followed by an admission date to Ravenswood, a false diagnosis, and a final entry. Sterilized, lobotomized, deceased. Transferred to permanent custody. Next to many names, payment receipts. Corporations, law firms, wealthy families paying the Institute to disappear problems, paying to erase witnesses. Lily found her own entry. Voss, Lily Eleanor, admission 04-1747. Referral source, Whitfield Textiles, Inc. Payment, $2,500. Witness 2, corporate bribery, labor violations. Risk level, high. Recommended treatment, dental ablation, suppress testimony capacity, surgical sterilization, prevent genetic transmission, potential lobotomy if compliance not achieved. They'd paid $2,500 to destroy her. The price of silence, the cost of a witness. She kept reading, kept memorizing, kept building the case in her mind. Hours passed. The evidence accumulated like snow, each file adding depth to the burial of truth. Then, footsteps, coming down the stairs. Multiple sets, fast. Lily grabbed one file. Just one, the ledger with the names and payments. She shoved it inside her uniform against her skin. The orderlies found her in room 7, surrounded by open cabinets, evidence everywhere. They didn't speak, didn't ask questions, just grabbed her arms and dragged her out. Dr. Thorpe was waiting in the corridor. His face was no longer afraid. It was resolved. A man who had made a decision. Transorbital procedure, he said to the orderlies. Tomorrow morning I'll perform it myself. Lobotomy. The final silencing. They threw her into isolation. But this time, Lily wasn't afraid, because the file was pressed against her ribs, the names of the disappeared, the evidence of the crimes, and somewhere above, inspectors were sleeping in a hotel, planning to return tomorrow. If she could survive until morning. If she could get the file to them. If. In the darkness, Lily pressed her ruined mouth against the gap beneath the door and whispered to the empty corridor, "I know all your names. I know what you did. I am the record you can't erase." Her voice was barely human, slurred, whistling, the voice of a woman with 11 teeth and a ledger pressed against her heart. But it was still a voice, and testimony, even broken, still counted as truth. Dawn came like a sentence being read aloud. Lily heard the boilers ignite at 4 a.m., heard the shift change at 5:30, heard the breakfast cart rattling through corridors at 6 a.m., the rhythm of the Institute continuing as though nothing had changed, as though tomorrow wasn't the day they would drive an ice pick through her eye socket and scramble the parts of her brain that remembered. The file was still pressed against her skin. She'd kept it hidden through the night, repositioning it whenever orderlies checked through the observation window. The paper had absorbed her sweat, becoming soft and fragile, the names bleeding slightly where moisture touched ink, but still legible, still evidence. At 7 a.m. the lock turned, not orderlies. Dr. Thorpe himself. Alone, unusual. He entered the isolation cell and closed the door behind him. In his hand, a syringe, pre-operative sedation, to make her compliant for the procedure. "You've caused me considerable trouble," he said. His voice was conversational, almost friendly. The tone of a man explaining something to a child. "The inspectors are asking questions. Nurse Patterson has disappeared, quit without notice apparently. And somehow, despite your complete isolation, rumors are spreading through the patient population." He sat on the edge of the bed. The springs groaned. "So I've been thinking about the most efficient way to handle this situation. And I've realized you're not the problem. You're a symptom. The problem is the system that allows women like you to testify at all." Lily watched him, said nothing. Her hand was pressed against her abdomen, where the file created a small bulge beneath the gray uniform. "The transorbital procedure is elegant," Thorpe continued. "A few seconds. An ice pick through the orbital cavity. Sever the connections between the frontal lobe and the rest of the brain. You'll still walk, eat, follow basic commands, but you won't remember, won't testify, won't cause any more problems." He stood, approached with the syringe. "This will make it painless, a mercy, really." "The files," Lily said. Her voice was destroyed, whistling through the gaps, but clear enough. "They already have them." Thorpe stopped. "What?" "The inspectors. Patterson gave them copies before she left." It was a lie, a desperate gamble, but Lily sold it with the commitment of someone who had nothing left to lose. Thorpe's face cycled through emotions: disbelief, calculation, fear. "You're bluffing." "Am I?" Lily smiled, her terrible smile. "Then do the procedure. See what happens when they return this afternoon and find me lobotomized. See how that looks in their report." The syringe trembled in his hand. He was brilliant at medicine, at manipulation, at institutional control. But he was not prepared for a woman with no leverage, who acted as though she held all the cards. "You have nothing," he said. But his voice had lost its certainty. "You're a mental patient, diagnosed by 3 physicians. Your testimony is worthless. My testimony is, the files aren't." She stood, slowly. 2,847 sterilizations. 284 lobotomies. 47 deaths. Federal funding, pharmaceutical contracts, corporate bribes, it's all documented. Every name, every payment, every crime. She took a step toward him. He took a step back. "You kept records because you thought you were untouchable. Because you thought no one would ever look. Because you thought women like us don't matter." Another step. He backed into the wall. "But we do matter. We're evidence, we're testimony. We're the bodies that prove what you did." Thorpe's hand moved to the door, but Lily was faster. She grabbed his wrist, her grip weak from malnutrition but desperate enough to hold. "I want you to know something," she whispered. "I memorized everything. Every name in those files, every procedure, every payment. If you lobotomize me, if you kill me, it won't matter. Because I already told Ruth. And Ruth told the others, and the others will tell everyone who comes after." It was partially true. She had told Ruth, through taps on the wall. A simplified version, but the women of Ravenswood had become a network, a living archive, passing information through walls and whispers. "You can't stop testimony," Lily said. "You can only multiply it." The door burst open. Orderlies responding to what? A panic button Thorpe had triggered? A scheduled check? It didn't matter. They pulled Lily off him. She didn't resist. Let them restrain her, drag her from the cell. But as they hauled her into the corridor, she made her move. Twisted violently, tearing the file from beneath her uniform. It fell to the floor, papers scattering. "What the—" One of the orderlies bent to collect them, and saw names, dates, procedures, payments. His eyes widened. He looked at Thorpe. "Sir, these are—" "Destroy them," Thorpe snapped. "Immediately." But the orderly was still reading, and his face was changing, because one of the names on the page was familiar. Patterson, Helen M., admitted 1929, sterilized 1930, released to domestic service 1932. Helen Patterson, Nurse Patterson's mother, dead now. But not before spending 30 years working in textile mills with no children, no family, no explanation for why. The orderly looked at Lily, then at Thorpe, then at the papers in his hand. "Get a supervisor," he said to his partner. "Now." Thorpe lunged for the papers. The orderly pulled back. A brief struggle. More papers falling. More names revealed. Footsteps. Multiple sets. The morning shift supervisor arriving. Then the assistant director. Then, impossibly, the inspectors themselves, early, brought by a call from someone who'd seen something suspicious. The corridor filled with people, with questions, with papers being picked up, read, passed from hand to hand. Lily slid down the wall, exhausted. Let gravity take her to the floor. let the chaos unfold around her. She'd done what she could, planted the evidence, let it scatter like seeds. Whether it would grow depended on soil she couldn't control. Dr. Thorpe was speaking rapidly, explaining, justifying. But his voice was being drowned out by other voices, the inspectors asking questions, the assistant director demanding answers, the orderlies whispering among themselves. One of the inspectors crouched beside Lily. He was young, perhaps 30. His face showed the kind of horror that only comes from encountering evil you didn't know existed. "Can you speak?" he asked gently. Lily opened her mouth, showed him the ruins, 11 teeth scattered across gums that would never fully heal. "Did they do this to you?" She nodded. "For medical reasons?" She shook her head. Then, with enormous effort, she spoke. "Punishment. For witnessing, for remembering, for being inconvenient." The inspector's face went pale. He stood, turned to Thorpe. "Dr. Thorpe, you're going to need to answer some very serious questions, and this facility is being placed under immediate state supervision pending a full investigation." Thorpe's face crumbled. The mask of clinical authority dissolving into the face of a man who understood his empire was collapsing. "You don't understand," he said. "These women, they're not reliable. They're mentally ill, they'll say anything." "We'll determine that," the inspector said. "After we review the files, all of them." 2 hours later, Lily was transferred from isolation to a medical ward. Not Ravenswood's medical ward, a real hospital, state-run, independent. As they wheeled her stretcher through the institute's main entrance, through doors she'd entered 2 months ago in restraints, Lily saw Ruth standing in a corridor window, pressed against the glass, watching. Lily raised her hand. A small wave. Acknowledgement. Ruth pressed her palm against the window. 5 fingers spread. A gesture that meant, "I see you, I witness you, I will remember." The ambulance doors closed. The institute receded, but Lily knew. The building would still be there tomorrow. Ruth would still be trapped inside. Hundreds of others would still be subjected to procedures they didn't consent to. One woman escaping didn't dismantle the system, but one woman testifying could crack its foundation. In the hospital, they examined her, documented her injuries, 21 missing teeth, forced abortion, malnutrition, trauma. The young doctor who treated her asked, why did they do this? And Lily, her voice ruined but her memory intact, began to recite names, dates, procedures, payments. The testimony of patient 2847, the record they couldn't erase. The radiographs told a story that words could not obscure. In June 1947, at St. Vincent's Hospital in Albany, a forensic dentist named Dr. Marcus Webb examined Lily Eleanor Voss and documented what he found. His report, preserved in the New York State Archives and declassified in 1982, remains one of the most damning pieces of evidence in the Ravenswood investigation. The X-rays showed a mandible and maxilla destroyed not by disease, but by violence. 21 teeth extracted, not surgically removed with precision, but torn out, roots fractured, bones splintered. The images revealed no infections, no abscesses, no pathology that would justify even a single extraction. Dr. Webb's conclusion, typed in the measured language of medical documentation, nevertheless carried the weight of accusation. The pattern of extractions demonstrates no therapeutic intent. The trauma to surrounding bone tissue indicates use of excessive force. The absence of any dental pathology suggests these procedures were performed for purposes other than medical necessity. In my professional opinion, this constitutes deliberate mutilation. Mutilation. The word appeared 17 times in his 40-page report. The radiographs became Exhibit A in what would eventually be known as the Ravenswood Inquiry. But gathering evidence was only the beginning. The machinery of justice moved with geological slowness, grinding against decades of institutional protection. Lily spent 3 months in St. Vincent's Hospital recovering. The physical wounds healed incompletely. Her gums would never fully close over the bone gaps. Her jaw would always ache in cold weather. Speaking would always require effort. But these were surface damages. The deeper wounds had no X-rays to document them. She learned about the baby from a sympathetic nurse who believed honesty was kinder than protection. A boy, fully formed at 6 months gestation, extracted during what the Ravenswood records listed as therapeutic intervention for maternal hysteria. There was no grave, no burial, just a jar in a sub-basement labeled with her patient number. The nurse held Lily's hand while she wept. There are no adequate words for this kind of grief. The mourning of a child stolen before you could mourn him properly. A loss that existed only in medical waste logs and preserved tissue. But grief, Lily discovered, could be weaponized. By September 1947, the investigation had expanded. Federal prosecutors became involved. The files Patterson had helped scatter led to more files, more witnesses, more women willing, finally, to speak. Ruth was among them. Released from Ravenswood after the state takeover, she testified about her own sterilization, performed in 1942 under the guise of appendicitis. She was 23 then. She had wanted children. They took that future without asking. The testimonies accumulated like snow, each woman adding depth to the burial of Ravenswood's facade. Agnes Kowalski, sterilized at 19 for being Polish and poor. Sarah Chen, lobotomized for reporting restaurant health violations. Mary O'Brien, electroshock therapy for refusing to marry her rapist. Dolores Washington, hysterectomy at 16 for promiscuity. She had been sexually abused by her employer. Women whose inconvenience had been medicalized, whose witness had been pathologized, whose existence had been deemed threatening enough to warrant erasure. But the most powerful evidence wasn't testimony. It was biological. It was irrefutable. The radiographs of Lily's mouth were duplicated and distributed to medical boards, legal teams, newspapers. The images appeared in the New York Times in October 1947, alongside an article titled, "Horror in Healing, State Asylum Accused of Systematic Abuse." The photographs showed a young woman's face, gaunt, hollow-cheeked, her smile a grotesque landscape of absence. Below, the X-rays, white bones, black gaps, the architecture of violence rendered visible. Public outrage was immediate and volcanic. Women's organizations mobilized. Civil rights groups demanded accountability. Even conservative medical associations, initially defensive, began quietly distancing themselves from Ravenswood's practices. Dr. Harlan Thorpe was arrested in November 1947. The charges: assault, battery, performing medical procedures without consent, fraud, and, buried in the legal language, crimes against humanity. His trial would not begin until 1949. The legal system required time to build cases, gather evidence, navigate the complex question of how to prosecute state-sanctioned atrocities. But while justice delayed, Lily continued her own work. She became a living archive, traveling to hearings, speaking to investigators, reciting the names she'd memorized from the basement files. Her destroyed mouth became her credential, evidence that she had paid for her testimony in bone and tissue. In December 1947, a young lawyer from the ACLU approached her. His name was Samuel Reeves, and he specialized in civil rights cases that other lawyers considered unwinnable. "I want to file a class action lawsuit," he told Lily, "on behalf of every woman Ravenswood destroyed. But I need a lead plaintiff, someone willing to have their name attached publicly, someone who won't back down." Lily looked at him with eyes that had seen the sub-basement archives, that had watched her child dissolve in formaldehyde, that had stared at Dr. Thorpe while he threatened lobotomy. "Use my name," she said. "Use my face. Use my X-rays. Use everything." The lawsuit was filed in January 1948, Voss v. Ravenswood Psychiatric Institute et al. The et al. Included the state of New York, the pharmaceutical companies that funded experiments, the Eugenics boards that approved sterilizations, and 73 individual doctors and administrators. The trial would take years. Appeals would extend into the 1950s, but the filing itself was a declaration. The women were no longer silent, no longer compliant, no longer willing to let institutional authority define their reality. And at the center of it all, the evidence that couldn't be argued away, couldn't be dismissed as hysteria, couldn't be lobotomized into silence. The radiographs of Lily's mouth. 21 missing teeth. 0 medical justification. The phantom teeth that proved the reality of institutional violence. Dr. Webb, the forensic dentist, was asked during a deposition, "Is there any legitimate medical scenario where this pattern of extraction would be appropriate?" His answer, delivered in the flat tone of scientific certainty, "None. This is torture documented in bone." The prosecutor pressed, "And the preservation of these radiographs, how significant is that?" Webb looked at the X-rays spread across the table, then at Lily sitting quietly in the corner of the room. Without these images, this would be a case of she said against institutional authority, dismissed as delusion, as false memory, as the unreliable testimony of a mentally ill woman. But bone doesn't lie. Bone doesn't forget. These radiographs are the most honest witnesses in this room. Lily touched her jaw, felt the gaps, felt the ache that never fully subsided. 21 teeth taken, 21 pieces of evidence that survived. She had become what Ravenswood tried to prevent, an irrefutable record, a testimony written in calcium and pain, a witness they could never fully silence, because even without teeth, even with a voice reduced to whistles and slurs, she could point to the X-rays and say, "This is what they did. This is what they are. This is the truth they tried to bury." And the bone, cold, white, eternal, spoke louder than any eloquence ever could. The verdict came on March 15, 1952, 5 years after Lily Eleanor Voss first entered Ravenswood Psychiatric Institute. Dr. Harlan Thorpe was convicted on 43 counts of assault and battery, 17 counts of performing medical procedures without consent, and 8 counts of fraud. He was sentenced to 25 years in federal prison. He served 11 before dying of a heart attack in his cell in 1963. The state of New York settled the class action lawsuit for $4.7 million, a sum that sounds substantial until divided among 2,147 plaintiffs. Each woman received approximately $1,650. Compensation for sterilization, lobotomy, experimental drug trials, forced abortions, dental mutilation, years of unlawful imprisonment, $1,700 per destroyed life. Ravenswood Psychiatric Institute was permanently closed in 1955. The building stood empty for decades, too contaminated by history for repurposing. It was finally demolished in 1989, the bricks and bones buried under what is now a shopping center parking lot in upstate New York. But this is not a story about buildings or verdicts or compensation. This is a story about what survives when everything else is taken. Lily lived until 1994, 47 years after Ravenswood. She never married, never had other children. The forced abortion had been accompanied by a sterilization she didn't discover until months later. Another procedure performed while she was sedated. Another future stolen without consent. She spent those 47 years doing something Ravenswood never anticipated. She remembered. In 1956, she published a memoir, The Teeth They Took, a Testament from the Forgotten. It sold poorly. America in the 1950s preferred to forget its asylums, its eugenics programs, its systematic destruction of inconvenient women. But the book survived, found its way into libraries, into women's studies programs, into the hands of activists who would build on what Lily began. In 1972, she testified before a Senate committee investigating forced sterilization programs. By then, she was 53 years old. Her hair had gone gray. Her face had aged into the geography of survival, but her memory remained crystalline. She recited names, the same names she'd memorized in the sub-basement of Ravenswood 25 years earlier. The senators sat in stunned silence as she listed procedure after procedure, payment after payment, woman after woman. Mary Kowalski, Sarah Chen, Ruth Hoffman, Agnes O'Brien, Dolores Washington. 200 names. She spoke for 47 minutes without notes, without hesitation, without error. "How do you remember all this?" one senator asked. Lily touched her jaw, the phantom ache that never left. "When they take your teeth," she said, "you learn to remember with other parts of yourself. Memory becomes bone. Testimony becomes marrow." The Senate hearings led to new legislation. The forced sterilization programs that had operated in 32 states since the 1920s were finally, officially, ended. Too late for the 60,000 Americans who had already been sterilized, but in time to prevent the next 60,000. Ruth Hoffman lived until 1987. She and Lily remained in contact, letters, phone calls, occasional visits. They never spoke about Ravenswood directly, didn't need to. They had lived it together, survived it together. That was enough. When Ruth died, Lily was the only person at her funeral besides the priest. Ruth had no family. The sterilization had ensured that. She was buried in a small cemetery in Vermont, under a headstone that read simply, Ruth Margaret Hoffman, 1918-1987. She was witness. Lily stood at the grave and thought about the girl Ruth had been at 23, bright, hopeful, reading contraceptive literature because she wanted to plan a family someday. That small act of autonomy had sentenced her to 6 years in Ravenswood and a lifetime of stolen futures. In 1982, the full Ravenswood files were finally declassified and released to the public. Journalists, historians, filmmakers descended on the archives. The story made headlines again. Secret files revealed decades of abuse at New York asylum. But Lily had already told that story. For 35 years. To anyone who would listen. The younger generation of feminists, disability rights activists, and mental health advocates found her, interviewed her, recorded her testimony, made her a symbol of resistance against medical tyranny. Lily tolerated the attention but never sought it. She had learned at Ravenswood that visibility could be dangerous, that being noticed could get you disappeared. What she wanted was simpler, for people to remember. Not her, necessarily, but the women whose names she carried, the ones who didn't survive to testify, the ones still in jars in basements, still buried in unmarked graves, still erased from official records. On her 75th birthday in 1994, a reporter asked her, "Looking back, was it worth it? All the pain, the testimony, the years of fighting?" Lily was dying by then. Cancer, ironic, given that her body had survived so much deliberate destruction only to be betrayed by its own cells. She sat in her small apartment in Boston, surrounded by files and photographs and decades of documentation. Worth it? She smiled her terrible smile, still all gaps and ruins even after 47 years. That's the wrong question. It wasn't about worth, it was about necessity. Someone had to remember, someone had to speak. If not me, then who? She died 3 weeks later, April 17th, 1994. 47 years to the day after entering Ravenswood. Her will requested that her remains be cremated, and her ashes scattered in the Hudson River, near where the Institute once stood. A final return to the place that tried to erase her. At the scattering, there were 37 people. Activists, historians, survivors of other institutions, descendants of women whose names Lily had memorized and preserved. One woman, a granddaughter of Agnes Kowalski, sterilized at 19, read from Lily's memoir. "They took my teeth thinking they took my voice. They took my child thinking they took my future. They took my freedom thinking they took my agency. But they miscalculated. Because memory doesn't live in teeth or wombs or cells. Memory lives in the spaces between. In the silences, in the gaps, and I became nothing but gaps, a living archive of absence, testimony written in what was stolen rather than what remained." The ashes scattered across the water, gray powder dissolving into gray river, becoming indistinguishable from the current. But the testimony remained, in books, in Senate records, in declassified files, in the radiographs still preserved in medical archives, X-rays of a mouth destroyed, bones that document institutional violence. In 2003, the New York State Legislature issued a formal apology for the forced sterilization programs, They erected a memorial in Albany listing the names of known victims. Lily Eleanor Voss appears on that memorial, as does Ruth Margaret Hoffman, as do 2,847 others. But there are thousands more names that will never be listed. Women who disappeared into institutions and never emerged. Women whose files were destroyed, whose graves are unmarked, whose families never knew what happened to them. Lily carried those names too, memorized them in the sub-basement, recited them in Senate hearings, whispered them in the darkness before sleep. They live now in the archive she became, in the testimony she gave, the bone-deep memories she preserved. The world tried to erase them. Lily remembered, and in remembering, she ensured that erasure failed. Tomorrow is the anniversary. 47 years since they took me to Ravenswood. 47 years since they began taking my teeth. I am dying now. Cancer, the doctors say. Ironic, but I am not afraid. I did what I promised Ruth through the wall that first night. I didn't let them take my name. I didn't let them take anyone's name. The teeth are still gone. 21 gaps that never healed, but the memory remains. The testimony endures. To whoever finds this, the work is not finished. There are still institutions operating, still women being silenced, still systems that pathologize inconvenience and medicalize control. Remember us, not as victims, as witnesses. We saw, we survived, we spoke, and we will not be disappeared again. In a world that tried to erase them, women who never returned remembers.